I woke up Halloween morning and my face was paralyzed. The right side of my face, I just couldn't move it. Ignored it at first and eventually just had to go to the emergency room because it was not getting better.
What is it? Awesome.
2 years ago, Luca was diagnosed on the autism spectrum. There's a lot of appointments that go into that, specialists, doctors, different programs.
My sister's name was Diane Lynn, and she came to be called Lenny. She was born in 1946 with brittle bone disease, or osteogenesis imperfecta. The doctor said she wasn't going to live.
I'm 21 years old, and this past year has been the first year that I've ever been covered by health insurance.
Different people, different stories. But the one thing they all have in common is Medi Cal matters to each of them. In fact, Medi Cal matters to more than 13 million people in California. That's about 1 in 3. Even if you're not a Medi Cal member, you probably know someone who is.
There are individuals that either wouldn't be alive or wouldn't have their family members with them if it weren't for the care and the services that we provide.
Any healthcare system that you walk into, it is influenced in part by the Medi Cal program.
Medi Cal matters to a diverse group of Californians. Some people count on the program for short periods of time. Others count on it for a lifetime.
Whatever we did, Lenny was with us doing it. We'd take her out of her wheelchair, we'd put her in the car, put her wheelchair in the back, and away we'd go. But through all that, she broke. She broke very easy. We got in a car accident once, and I think she had like 6 broken ribs and a broken vertebrae. And there were always those predictions of that, oh, she wasn't going to make it to toddlerhood. If she made it to puberty, that would be a miracle. Well, she died when she was 67 years old, so she kind of beat all the odds. My sister was on Medi Cal, and she got the best care possible. And she probably lived to be 67 years old because she was on Medi Cal.
Medicaid was signed into law in 1965 by President Lyndon B. Johnson. Medi Cal was then established a year later in 1966, mainly to cover children and people with disabilities.
Starting in the 80s and 90s in California, there was really a concerted effort to try to increase the number of populations covered by Medicaid.
Today, more than 400 hospitals, 22 managed care health plans, and approximately 140,000 healthcare providers participate in the Medi Cal program. Many healthcare facilities depend on Medi Cal funds to survive. Without them, many communities would be without access to healthcare.
Community Medical Centers is a private nonprofit. In 2015, CMC served 72,000 patients through 230,000 visits. Medi Cal is very, very important to community medical centers. Medi Cal has grown from originally probably only 10% of our patients. We're up to around 75% of our patients have Medi Cal. It's just increased access to care phenomenally.
It's an increase bolstered in part by Medi Cal's 2014 expansion through the Affordable Care Act, an expansion that made health care a reality for millions more Californians who previously did not qualify.
Really what we saw was a policy change where we call it the bright line, in terms of the income level became the only real factor in whether someone's in Medi Cal or not.
About August, September 2015, transitioned out of my job and my insurance ran out. You don't plan on these things, but I got sick. I went from getting an allergy to Bell's palsy. I went to the hospital Halloween night. One of the folks, who helped admit me said, hey, why don't you apply for Medi Cal? This could be costly. And I did and was lucky enough to get emergency coverage. Medi Cal made all the difference in the world to me. Even the confidence of just being able to put on a suit and look right. My health helped get me there. I definitely believe Medi Cal matters to all Californians. You can't put a price on health.
The program went through many changes because the population changed and the population grew, and how we thought about healthcare changed as an industry and as a nation. I would have to say, though, the biggest accomplishment was being able to be flexible enough and nimble enough to grow with the changing needs and the dynamics of the populations we serve.
Luca was 4 when we got the autism diagnosis, but probably when he was 2.5 was when we realized that there was something amiss.
Good job, Luca. One hand, other hand.
After we got the diagnosis, we were able to work with the local autism specialist here, and they had mentioned Medi Cal, and they had said, hey, you know, he qualifies for Medi Cal as someone on the spectrum. So that's what we did, and there was no change in services. We didn't lose anything. One of the biggest benefits of having Medi Cal insurance is Luca is able to get the ABA therapy, which is one of the main autism therapies.
Can I have a hug? Yeah.
He's talking in complete sentences now. He's able to, as much as I don't like it, able to tell me no if he doesn't like something, you know, and explain why. And it's just really opened a lot of doors for him.
Woo!
Medi Cal's focus on healthy children has proven to be our state's foundation for a healthy population.
Medi Cal has consistently, year over year, provided coverage for at least half the births in the state of California on an annual basis. I think that's quite a testament to what the program has meant. So committed to people at their earliest start in life.
At the end of the day, if we did not have this system, you know, there would be a lot more disease and issues with populations that don't regularly have access to healthcare services.
Medi Cal is a huge economic driver in California. Today, it's in upwards of $90 billion. The providers that provide services to our beneficiaries are part of the California economy.
You know, Medi Cal is a really cost-effective program. It is very low cost per enrollee, and it does a whole lot for a very relatively small amount of state general fund money.
People who receive Medi Cal benefits, they deserve a good product. The taxpayers and other sources of funding deserve to know that we are making best use of the dollars.
I am an undocumented person living in the United States. Every illness, every injury was treated on the basis of, can you survive if you don't go to the doctor? One of the things that I discovered is that a lot of DACA recipients aren't aware that they can apply for Medi Cal. I first got Medi Cal last year. For a while, I had been advocating for healthcare access in the Central Valley. While I was telling people to get signed up to get covered, I myself wasn't covered. Today, I'm gonna have my first ever visit to the dentist's office. I think that's a big change in the way that I've done healthcare up to this point. My family is still getting used to having healthcare coverage, but I think that's something that we're gonna take every chance we get and make sure that we are the healthiest we can be, the most productive that we can be, and that we can access healthcare without worrying about the price tag of our lives.
Medi Cal matters because it gives all of us an opportunity to be healthier. It gives all of us an opportunity to be a little bit more compassionate.
We can talk about 13 million Californians, $94 billion, and you wonder sometimes on a day-to-day basis if you're making a difference. And then you get letters where someone says, absolutely, you know, without you, I would not have had the care I needed, or I wouldn't have had a place to live. When you get those kind of little signals, it just indicates to you that you're doing meaningful work.
Medi Cal matters to us all.
Medi Cal matters to our community.
Medi Cal matters to me.
Medi Cal matters to me.
Medi Cal matters to community health.
Medi Cal matters to California.
Medi Cal matters to healthy babies everywhere.
Medi Cal matters to California seniors.
Medi Cal matters to me.
Medi Cal matters to us.
Medi Cal matters to us.
That's right.